Hi, all. Welcome to our live stream today. My name's Peyton. I am the head of patient care here at Heal Navigator. Heal Navigator is a platform that assists patients and family for finding alternative treatment options, whether in clinic or remote options that may be available. We provide information about clinics around the world. And today I'm happy to introduce to you Oasis of Hope Hospital and Dr. Contreras, who will be joining us for this live event. I had the pleasure of traveling to Oasis of Hope many of times in Tijuana, Mexico. So I'm happy to provide this opportunity to you guys for a deeper dive into what their facilities offer. Dr. Contreras, if you want to join us now, you're more than welcome to get on camera and mute yourself, say hello.
Hello, and thank you very much. It's my pleasure to spend this time with you, Peyton.
Thank you so much. So today we'll cover some top integrative cancer therapies that are available in Mexico. We also have three amazing bonuses for being on this live event. Dr. Contreras will have a short Q&A at the end, as well as we'll be covering some of those questions that you guys have submitted prior to this event starting. So thank you for all of those amazing replies that we received. If you guys have personal questions about Oasis of Hope, we are able to connect you guys with some doctors that will be on staff of Oasis of Hope to provide you a free one-on-one call. You guys can email info@healnavigator.com, and my team will drop it both in the chats of YouTube, and I as well will type it here in the chat of Facebook. To where you guys can email in, just let us know that you're interested in this call, and then we will put you into contact and walk you through the next steps, such as giving you that medical questionnaire for you to complete, as this is important to have that one-on-one call with their team. Oasis of Hope is also generously offering a $3,000 grant to Heal Navigator's patients that we are referring over to them. And we'll dive in deeper later on with Gaston, who is part of the Contreras family, that will be going into more information about that. Feel free to use the chat function in the live. We'll do our best to respond throughout the event, both on YouTube and Facebook. And now for a formal introduction of the doctor and the clinic. Dr. Contreras is a leading integrative oncologist and is part of the founding family of Oasis of Hope that was established in 1963. With over 40 years in cancer treatment, he blends conventional and both alternative therapies, focusing on holistic patient-centered care. Dr. Contreras has treated over 100,000 patients from 60 different countries, gaining global recognition of his approach to cancer treatment. His philosophy combines advanced medical treatments with nutrition, mind-body techniques, and also a spiritual approach to healing to support the overall mental, emotional, and spiritual needs of the patients, as well as the physical. So it's great to have you here with us, Dr. Contreras. We can dive in. You're more than welcome to share any brief information about you or your facility if I did not cover it already.
No, thank you, Peyton. That was an incredible introduction. Probably my mother wrote it for you. It's so nice. Thank you very much.
Yes, we're very in touch. I hear about her greatest recipes. I'll cook for you later. No worries. So let's just start off by, can you share a little bit about yourself and what inspired you to being in the alternative cancer treatment realm? What's your family, forging this path for you? I know it was kind of already placed in the forerunning of yourself, but can you share with people that are not familiar with the Contreras story or Oasis of Hope, or who you are?
Well, my father was a very renowned and orthodox oncologist in Mexico in the 50s and then up to the 60s. And he was very frustrated, even at that time, because the results were very, very poor. And he came to the conclusion that the reason for the failure was not really technical or lack of interest or lack of money, but that philosophically we were going in the wrong direction. And what I mean by this is that philosophy, still to date, behind the solution to the war on cancer is based on what happens to the tumor. And it sounds logical. If you have a tumor, you want to get rid of it. But the patient forms then a secondary role in all of this process because all the aim is put into the tumor. And then we measure results on what happens to the tumor rather than on what happens to the patient, to the extreme that if you offer a treatment and the tumor goes away, the patient goes into the books as a success, even if the patient died because of complications of the therapy. So we believe here that our aim should be what happens to the patient. And this is based on two philosophies. First is what Hippocrates, the father of medicine, said, first do no harm. And so the first thing that we want to do is to improve as much as possible the quality of life of our patients. And unfortunately, many of the orthodox therapies, conventional therapies, are very devastating to the patients, especially chemotherapy, but radiation and sometimes massive surgeries can deteriorate the quality of life of a patient for life or for the rest of their lives. The second philosophical principle is what Jesus said, love your neighbor as you love yourself. And we interpret that as loving our patients as we love ourselves. And so that obviously means that I would never give to a patient whatever I am not ready to receive myself if I were in the position of the patient. And so based on these two philosophies, we design our therapies. First, do no harm, and then whatever I'm going to give to the patient is something that I'd be willing to take myself. And I'm sure that you know that many oncologists would never touch chemotherapy. Radiation therapy, they're a little bit more open. And then to initial surgeries, they're also open to that. But mostly, as far as chemotherapy is concerned, most of them would not receive it because it's so devastating. And the possibility of help is minimal. There are exceptions to that rule, as for everyone. There are some tumors where chemotherapy really shines. There's very few of them, but in those cases, we recommend chemotherapy. For instance, in lymphomas, where the success rate is above 90%, sometimes up to 95%. Well, in those cases, then definitely the benefits outweigh the risks. And as you mentioned, another reason for the failure is that we are focused only on the body of the patient, and the patients, all of them, have very profound emotional and spiritual needs when they are facing death, when this cancer is threatening to take their lives. It's a very stressful situation. So we also provide emotional and spiritual resources so that the patients can better confront their condition with more hope. And that's why we're called the Oasis of Hope. In fact, the name was given to us by a patient that was given only a few months to live and came to our clinic, then went home. 5 years later, he comes completely free of tumor activity, and he said he came from Italy, and he brought a present for my dad, and he told him, I'm giving you this present because this is an Oasis of Hope. And since then, we adopted that name. And we've been, severely criticized for selling false hope. And to me, the question to all of those oncologists that tell me that when they accuse me of that is, I ask them, well, if I'm selling false hope, what is true hope? You're dead in 3 months. If you take chemotherapy, you may live a year, but still you're going to be dying. And so my position is that there is no true or false hope. There's hope or no hope. And hope is a very powerful tool that every patient can use for their favor. Well, one way to explain that very easily is that if you look at all of the prospective clinical trials, double-blind, that have been done over the years. In most cases, the placebo group do better than the treatment group. And what is that? Well, the hope, right? The positive mind, the thinking that they're going to do better. So if that has been proven, why not allow the patient to have that possibility? And so in a nutshell, philosophically is what separates us more than anything from any other oncological center, alternative or non-alternative, integrative or not. And I believe very strongly that we should always practice the best medicine possible, not alternative or conventional, but the best. And that may be taking from each side whatever is best for the patient, depending on their condition. And so here at the Oasis of Hope, we have everything available to the patients, new therapies, old therapies, like the targeted therapies or the old therapies such as hyperthermia that has been around for many, many years, and it has proven to be quite effective.
Thank you. I do believe this is what is unique about your facility also.
Yes.
When some people hearing about a hospital in Mexico, I know I often get a lot of questions like, is it safe? Or like, are these American doctors? Or, what treatments are they offering that are different than what are available here in the United States? Could you maybe perhaps touch base on maybe some of those concerns and dive into some therapies that you offer at Oasis that might not be offered, in other places of the world due to regulations?
Yes, well, it is true that there's always been some turmoil in Mexico, but Tijuana is about a 3 million people city that's well organized, that where we live in peace in spite of the turmoil that may happen in some areas of the city. We have never had a negative event, thank God. And it is very safe. I mean, right now we have 20-some patients, most of them from the States, a couple of them from Australia, about 3 of them from Canada. And so in general, I don't think that Tijuana is more dangerous than Chicago or LA, where you don't feel that safe. In the area where the hospital is a very safe area. And again, we've never had a problem with that. Now, as far as our therapies, as I mentioned before, we have everything available to the patients, but we treat cancer more as a metabolic disease than a genetic disease. There's no question that cancer is a genetic disease, but treating cancer genetically, which is what has been done now with targeted therapies, is a daunting endeavor. Why? Because targeted therapy only targets, as the name says, one mutation. And tumors have, in general, dozens, if not hundreds, of mutations. So in order to cure cancer, really, you would have to have targeted therapies for all of the mutations.
Right.
And that's going to take a while. New targeted therapies are being developed according to mutations. And we're very happy about that. But once all of them are done, then the second problem is going to be the cost, because each targeted therapy to date, it's around $10,000 every 3 weeks or every 2 weeks, depending on the protocol. And so let's say that you need 100. So every 3 weeks, you need to come up with $1 million or more. So it's going to be a very complicated thing. So we treat cancer on what the impact of those mutations have on the metabolism of the patient. And those are very few. And they're common to all cancers. And so that's a part of the therapy that's common to all of the patients. But then we personalize the therapy to the extreme when we prepare an immunological therapy called the dendritic cell vaccine, which is very specific for that patient and that patient alone. And so this is a therapy where we create from the patient's tumor cells a specific anti-tumor task force within the immune system to attack that tumor. So that way, we have a very powerful combination of a therapy that's common to all cancers with a very personalized therapy as far as the immune system is concerned. And I truly believe that the future of cancer therapy is in the immune system. And I'm very happy to see that until now, that was not the aim of the conventional world, but more and more immunotherapies, targeted immunotherapies, are being developed in America. And the other very good news is that no new chemotherapy agent has been developed in about 12 years or 13 years. And I truly believe that chemotherapy is going to be a thing of the past, probably within a decade or 15 years, because these new immunotherapies are going to be much more effective. And we are at the forefront of that development, even though these methods were developed in the States. They have not been approved, well, except for cancer of the pancreas. Now, dendritic cell vaccine has been approved finally after 2 or 3 decades. 2 decades, it has been approved for cancer of the pancreas only, and I think that little by little it's going to be approved for more cancers. But here in Mexico, dendritic cell vaccine has been approved for all tumors now for about 15 years, and that's why many patients come to Mexico for our therapies here at the Oasis.
Yeah, and I recently heard that you guys are doing it in-house with the dendritic.
Yes, we have worked diligently for years to have our own immunological laboratory. Is a very high-tech laboratory, world class, with world-class specialists in that area. And hopefully next time you come, you'll visit our laboratory. We're very happy and proud of the work that we are now doing in our laboratory as far as the dendritic cell vaccine is concerned.
Yeah, I hope to see you guys sometime this year towards
Yes.
fall, winter time. It's usually when we make our trip. But it'll be great to get photos and take content of the lab that you guys and new programs, things like that you guys are launching.
Yes, and you'd be able to see quite a bit of the process. It's a very sophisticated process, but it has given us wonderful results. Today I saw 3 follow-up patients where they virtually had no hope, and their new PET scans are completely free of tumor activity, what we now call no evidence of disease or NEDs.
Yes, I will be touching base on that here shortly with some patients that I have worked with personally that have gone to your facility that's reached no evidence of disease or in a very stable position with some very grim prognoses. I do want to ask though, hyperthermia. It seems to be a very popular treatment in the integrative alternative clinic space. Can you explain how it's used for cancer treatment and how your facility offers this differently than other facilities, and what cancers might respond better to it, or how you gauge this in the patient's overall evaluation?
Yeah. Hyperthermia was first mentioned as a treatment in the 19th century in Vienna, where I studied surgical oncology. And what happened is that this oncologist noticed in the time where there were no antibiotics yet developed, that some of his cancer patients that developed very severe infections and survived the infection, the tumors went away. So he noticed that these patients had extremely high fevers, and that the fever somehow played a role in the reduction of the tumor activity. Thereafter, many years after, a doctor from Massachusetts General Hospital, from Harvard, developed then what he called the coli vaccine.
Mhm.
And this is a number of attenuated bugs, bacteria that would cause fever in a controlled way. Thereafter, the Germans and the Russians started thinking that there would be other ways to provoke fever without the danger of actually infecting a patient that's immune suppressed, already immune depressed, cancer patients, or patients that are in very poor conditions where an infection could actually kill them, or you just make the whole thing more complicated. And so they started developing ways of increasing the temperature in a controlled way. And the first method that we used here was actually heating the blood. So we would connect the patient to a heating machine, a machine similar to a dialysis machine, where we would have to connect two veins, actually, one where we would remove the blood. It would go through the heater and come back into the patient. This is a method that continues to be done to date. It's a very effective way of heating a patient to temperatures that are therapeutic. And thereafter, the Germans started building heating machines where you would put the patient like in an oven. It's virtually an oven. It was complicated because high temperatures can cause brain reactions and even convulsions. And it took a while to develop these machines to where you can get the temperature very high on the body of the patient while not on the brain. And so we've developed here our own cocoon is an area of a machine where the patient goes in, and this has a convection oven technology with infrared light, where we, in a very short time, are able to bring temperatures up to 41 and a half degrees Celsius, a very high fever, where the brain is not affected. And this is the method that we use here. How does it work? Well, our normal tissue, because it grows taking time, has a very organized circulatory system. And our circulation, our vessels, veins and arteries are our radiator. That's how we get rid of heat that is produced by our metabolism. Malignant cells, because they grow so abruptly and so unorganized, their arteries and veins are very convoluted, and they cannot get rid of heat. And that's why when you heat the whole patient, our normal cells can withstand that heat, but malignant cells cannot. And so you can actually kill a tumor with heat. Now, in order to do that, you have to expose the patient for many hours, and it is not possible to do. So there are two other things that hyperthermia does that are very convenient for us as oncologists to have when we are treating a cancer patient. The first thing, and virtually the main reason why we do this, is that it increases the oxidative stress of the tumor. And this is the best way to kill a cancer cell, by oxidating the cell. So they're called oxidative therapies. For instance, all radiation therapies kill tumors through oxidation. Many chemotherapeutical agents kill cells through oxidation. And so hyperthermia will produce this oxidative stress that will last sometimes for weeks with one treatment that will continue to kill those malignant cells. And this is the main reason why we use it. It also potentializes the possibility of other oxidating therapies so that you have a synergistic effect. And for instance, high-dose vitamin C will kill cancer cells through oxidation. So combining both has a synergistic effect, and this is precisely how we use it here. Another benefit, very high and important benefit of hyperthermia, is the immune stimulation, a very strong immune stimulation effect on the patients. So hyperthermia is a wonderful tool that we have available to help our cancer patients.
Thank you for that. And I also believe too, it helps support the lymphatic system too, and do detoxification and that process
Yeah,
as well.
detoxification is, and thank you for reminding me that, because it's an important factor. The other ones are the ones that get me excited, because it's destroying tumor cells without any side effects whatsoever. But yes, in the process, you will be detoxified because the patients obviously are going to sweat profusely.
Yes, absolutely. And they get popsicles afterwards too.
Yes, that's true. That's true.
Before we move on to the next topic about the Oasis of Hope Hospital, I just wanted to introduce your book that you have written. I was gifted this copy whenever I traveled to Oasis of Hope, and Gaston has, sorry for the buzzing, they are doing yard work at the perfect time. But Gaston has mentioned to me that he has given away 5 copies of this signed by Dr. Contreras, and to those that have shown up to the webinar and are participating in the comments. So we'll go through my team and I and select those from YouTube and from Facebook for those that are participating. I've actually read this. It was a beautiful read. So bravo on your work. If you want to touch base on this, you're more than welcome to, just so they know what this book is about.
Thank you. And as soon as you send me the names, I will personalize those books for your patients.
Thank you so much. So yeah, can you provide like an overview of Oasis of Hope's approach to treatment and how it differs from conventional therapies? I know that you touched base on it, but I do know that you haven't mentioned things like EBOO or some other modalities that you guys offer. I know that we're focusing on the whole mind, body, soul, but can you even touch base on the nutritional program as well that you guys offer too? And how you work with the nutritionists and the chefs, and just kind of dive into those that aren't aware of Oasis of Hope.
Well, I mentioned at the beginning that our approach is to treat cancer as a metabolic disease, and I mentioned that there were a few common denominating factors to all tumors metabolically. So one of them is that because the cancer grows so convoluted, the tumors are even though they produce a lot of vessels, the tumors are hypoxic. The tumor tissue is low, very low in oxygen, and the tumors like this because it's an environment that helps them grow better than with oxygen as the normal cells would do. And so all tumors, regardless of whether it's cancer of the breast, the brain, the colon, all tumors are hypoxic. And so that's an aim, right? So for instance, you mentioned EBOO. Bringing oxygen inside of the tumor is very damaging to the patient. And so ozone therapy is the only thing proven to increase the oxygen content or concentration within tumor tissue. You can increase oxygen in your body by doing aerobic exercise, for instance, breathing oxygen, but that does not increase the oxygen within the tumor. So ozone does that, and that's one of the important therapies that we have here, because in order to do oxidative therapy, there has to be oxygen. If there's no oxygen, oxidative therapies do not work. So that's one common denominating factor that's common to all. Because tumors are hypoxic, they metabolize sugar very poorly. And so for every unit of carbohydrates that we consume, our normal cells produce a tremendous amount of energy, 32 units of energy for 1 unit of carbohydrate. Tumors, on the other side, for every unit of carbohydrates or sugar, they only produce 2 units of energy. So in order to compensate that, they are bullies for sugar. They need a tremendous amount of sugar. And so, again, regardless of whether it's colon of the cancer of the pancreas or the colon or the stomach, they all need a tremendous amount of sugar. And you mentioned nutrition. So doctors say normally, no, diet doesn't play a role, but go and do a PET scan. I don't know if you have ever heard of PET scans, but on a PET scan is a very specialized X-ray for cancer patients where they inject sugar that's stacked with a radioactive material. And because the tumors absorb that sugar and they have this radioactive material, the tumors actually light up and it's very easy to see them. So we know that tumors consume a tremendous amount of sugar, so not giving them sugar would make sense. And that's part of our diet. So that's another common denominating factor. Another one is because of this metabolism, tumors are acidic. Tumor tissue is acidic in comparison to the rest of the body. Now, it doesn't matter how much alkaline water you drink, the acidity of the tumor is not going to change. There are only two things that have proven to change the pH or increase the pH of tumor tissue, and that's baking soda and omeprazole. Omeprazole is a drug very well known that you can buy over the counter for gastritis. And so we use all of these methods to address the therapy in a metabolic way so that the patients will destroy their tumors or at least will make them more liable to true anti-tumor agents. And we have natural anti-tumor agents that we use, like amygdalin, or most well known as B17, although it is not a vitamin. And so B17 is going to be a lot more effective. Even chemotherapy is going to be a lot more effective, or radiation therapy, when you prepare the patient to be treated with oxidative therapies. But our main oxidative therapy is high-dose vitamin C. And it's incredible because most of you will think, well, how are you using that to oxidate if vitamin C is a very potent antioxidating agent? And that is true. But at very high dosages and in the presence of oxygen, vitamin C turns into an oxidant and kills malignant cells with the same mode of action as radiation therapy or chemotherapy without any side effects. And so the hyperthermia helps, the ozone therapy helps, and everything works in combination to make the tumor more liable, and thus natural therapies without side effects are very effective. And if on top of that you have an anti-tumor task force from your immune system, well, then the results are going to be better. And that's what we have experienced here at the Oasis of Hope for many years.
Sorry, I had to mute myself because of the people that were buzzing around. But I just wanted to say thank you for touching base on that. And I just wanted to touch base on one more question too before we move on to some patient questions that came through. Earlier, we kind of touched base on success rates and statistics. I find that this is a very interesting topic for a lot of patients that I connect with. They have a lot of questions when it comes to this because, as you know, standard of care, they provide those whenever you're meeting with an oncologist. So could you provide, some success rates or statistics that you see the most success with certain diagnoses at Oasis of Hope? Commonly, I share the stories of, Jeremy with his advanced colorectal cancer. He did everything standard of care. We hosted him actually on our Facebook as well. He went to Oasis of Hope. He's been no evidence of disease following that. Also, I sent over Stephen, who had advanced glioblastoma. I actually got to meet him in person when I came to your facility, which was beautiful while he was there during treatment. And I refer a lot of patients that have glioblastoma to connecting with him to hear his experience because he's been, in a very stable position since then.
Yes.
So can you touch base on those rates, please?
Yes. Well, the gold standard to determine whether a therapy is effective or not are the prospective clinical trials, and if they're blind or double blind, they're more credible. We are a small institution, and it's very expensive and very difficult to do prospective clinical trials. We have been able to do several prospective clinical trials, and you have to get a group of patients, and you have to follow them for 5 years. And everybody believes that a 5-year study takes 5 years to do. Well, no, it can take up to 10 years. Why? Because you don't get all of the patients with the same characteristics all at once. And so in a small institution like ours, it may take 2 or 3 or 4 years to gather a group that you can then follow for 5 years and then publish the results. The second complication that we have is that we're a private entity. And so in order for you to do a double-blind study, you have to have a group that receives the therapy and the other group that receives the placebo, correct? It is not ethical for a group like ours to treat patients in this way and charge them the same, because then everybody would know who's in the placebo and who's getting the therapy, and then it's not blind. So there are methods that are allowed for a private entity like ours to do prospective trials and do the comparison to a published group with the same characteristics. So if I have a stage 4 cancer of the colon study, then I design the study according to what has been published, and I choose the patients exactly the way that they were chosen in that group. And then at the end of my 5-year survival rate, 5-year study, which may take 7, 8, 9, 10 years, at the end of the study, then I compare it to that group. And that's kosher. That is acceptable. And this is the way that we have been able to do prospective clinical trials. And we've done it for the most common tumors because those are the cases where we can gather the number that you need to get in order to follow up. So for instance, in cancer of the colon, and you mentioned one of them, one of our patients, our survival rate is twice as long or twice as better than with conventional therapy, with a caveat. In the study groups, when you do prospective clinical trials, the patients arrive to them virgin to treatment. So they're stage 4, very advanced, and then they're treated with the standard of care. Well, the patients that come to us are the ones that were sent home to die after failure of the therapy. So we have an added complication where these patients already were treated with very harsh therapies, and so they're very deteriorated. In spite of that, our 5-year survival rate in colon cancer is twice as that published by the conventional therapies. In cancer of the ovary, our 5-year survival rate is 3 times better. Now, the tumor that we treat the most is breast tumors, patients that come to us in stage 4 breast carcinoma. We have many, many patients because our results have been so good. So our survival rate in patients that already were treated and came to us, the 5-year survival rate is 3 times better. When a patient comes to us virgin to treatment, the same as they're in America, our 5-year survival rate in breast cancer stage 4 is 5 times better than with conventional therapy. In all of the rest of the tumors, we have not been able to do prospective clinical trials, but we have retrospective studies which give you good information. They are not as reliable as prospective, but I can tell you that in all tumors, all stages, our overall survival rate is around 30%, which is very, very good when you compare it to others. For instance, in glioblastomas, the 5-year survival rate is virtually 0. And our 5-year survival rate is about 9%. You may say, well, 9% is nothing to write home about. Nobody has that. Nobody. So we're very proud of the work that we do here. And as much as we can, we want to scientifically do everything in the proper way so that we have correct evaluations. And we never offer a therapy or a modality that does not have very good scientific backup or background.
Thank you so much for touching base on that. It's a very common question. I get it every call. So I just wanted to actually embrace the fact that you do have this information and that you pride yourself on it. So especially with you guys being around for as long as you have and being like the forefathers of alternative treatment facilities in Mexico. I'm going to do a rapid fire of questions because we have quite a bit of questions that we got in prior to the call and also during the call. So just short prompt responses. If people want more in-depth calls, they can always have a call with one of your team members, send in your medical records, things like this. Dr. Contreras even does some Zoom calls as well for the patients that are ready to go to Oasis of Hope as well. So you can connect with him one-on-one too if you're considering the facility. So to start off with, a patient question that came in is, what are the most effective integrative cancer therapies for hormone-driven cancers, such as breast cancer, prostate cancer, and so forth?
It will depend on how strongly the tumor is dependent on the hormones, but we do combine, especially in our breast carcinomas and prostate carcinomas, the conventional hormone therapies with our therapies. And again, our 5-year survival rates are through the roof in comparison to using chemo and or hormone therapy alone. So yes, we will use hormone blocking agents as well.
Thank you. That's a common question I have. A lot of people are trying to avoid those hormone blockers or Lupron injections, things like this. So sometimes people are just trying to figure out if there's anything alternative that can potentially.
The main difference with us is that depending on how aggressive this tumor is and how advanced, we use the hormone therapy for a time to stabilize tumor. So look at it this way. We are in a race. And when the patient comes here, the tumor is way ahead of us. And we have to level the playing field, so to say. And so we're going to put stumbling blocks to the tumor. And once we level the playing field, where we know that the tumor is stable or in a manageable way, then we can use only alternative therapies. Remember that alternative therapies are slow work. They're very effective, but they are slow acting. And if a tumor is way ahead of us and the tumor is threatening the life of the patient, we need to bring that tumor activity down to levels where alternative therapies on their own can be successful. And so the difference with us is that we are going to be using the conventional elements until we level the playing field, and then no more conventional. And that happens in many, many cases.
And a lot of alternative facilities do utilize even low-dose chemo methods to suppress the cancer, especially if it's stage 3, stage 4, to allow the natural therapies to work more effectively. So I do see this as well, but thank you for acknowledging that. Are there any dietary approaches that are particularly effective for certain cancer types? People are asking about carnivore, vegan, keto, fasting. What's your take of all these different types of diet?
That's a very good question. It's a loaded question because the best diet is the one that you can do.
Right.
What I mean by that is that the literature shows that for most tumors, the best diet for a cancer patient is vegan, low glycemic. And when a patient is first diagnosed, they say, I'm going to do whatever I need to do. And if the only thing that I can eat is green peas, that's what I'm going to do. But usually by the 3rd month, the patients come to the conclusion that if that is the diet that they can eat only, that they'd rather die. So we have worked diligently and profusely on our diet with nutritionists and chefs to come up with a doable diet for life, where we are not so strict, but the diet is still effective. And I urge you to look into our website, and you will see the patients actually love our diet. It is not the most strict, but again, it's something that is doable. There is a keto diet that is very effective for brain cancer that has been published and proven. Now, the keto diet for cancer patients is not the same as the keto diet to lose weight. The keto diet for a cancer patient is extremely complicated. It is fats only. Think about it. You cannot have one iota of carbohydrates or protein, only fat. This is extremely, we tried it here, and we did a prospective clinical trial with the keto diet, and we couldn't finish it because the patients couldn't do it. In fact, 2 or 3 patients that they were arriving to the date, we actually sedated them to be able to finish the protocol. The results were good, but not good enough to withstand the difficulty of doing that type of diet. So yes, there may be some diets that could be different for this tumor and not, but overall, you need to have a diet that is low glycemic and more plant-based than not. That's the diet that is the best for cancer patients.
Yeah, a lot of micronutrients are in plants, and
Yes, definitely.
that's needed. And low glycemic too is key. A lot of people are on vegan, but they're not aware that a lot of carbs are in a lot
You
of
may be
different
vegan and
vegetables.
eating a lot of bananas, and then you're helping the tumor because the tumor doesn't care where the sugar comes from.
Yeah,
From
sugar,
a
sugar,
banana
starch,
or an ice
carb,
cream.
everything converts to protein, the fat, and the carb. Carbs convert to sugar, unfortunately.
Yes.
Yeah, yeah. We hear it a lot, even on our end. It's a million questions that I get about it. Speaking of diet and ketogenic, because this is a question that comes in, are you guys using repurposed medication to support metabolic healing? So like mebendazole, doxycycline, atorvastatin, metformin. There's practitioners Thomas Seyfried, Jay McClellan, Nasha Winters. We have Dr. Meekin on our team that are using these. And a lot of people are trying to find facilities that are either going to be supportive if they were to go to a facility and they're already utilizing this, or somewhere that they can help get, their boots and feet on the ground with these types of protocols.
Definitely. That's an important part of our therapy. And we privilege metformin for 2 reasons. Metformin will not alter the blood content, the blood sugar content on non-diabetic patients. That's a big plus, because otherwise, patients that do not have diabetes feel awful basically the whole day when you lower the blood sugar.
Right.
Secondly, metformin has proven to kill stem cells from cancer, and so it's an important tool within the therapy here at the Oasis.
Thank you so much. Also, what's the latest research on most promising natural treatment strategies for metastatic cancer? Specifically, people are asking about really metastasis to the bone, but metastasis overall as well.
I think that what's going to change dramatically the treatment of cancer in the next few years is going to be targeted immune therapy. And I'm not just talking about the Keytruda and the Vivo and on the conventional side. Development of dendritic cell vaccine and CAR T cells, I think it's going to be the future. The problem with CAR T cells, and we're hoping that within a year we'll be able to produce CAR T cells, which is a much more sophisticated.
Like the Cadillac.
Yeah. The problem is the cost. In America, each application is $400,000 thereabouts, or more or less, a little bit less. And you need several. So you have to be very rich to achieve that. We believe that when we're done with that, when we're able to do it, it's going to be in the area of the $50,000 per application, which is more doable. Still very expensive, but doable. And I think that the future is in that. but the refinement, as we have been doing in the last 12 years with the dendritic cell vaccine, it's also going to change the way we treat cancer patients in a more effective way. And we have been able to, little by little, lower the cost where we can revaccinate patients more. So our protocol is revaccination every 3 months right now, basically because of cost and the fact that our patients come from all over the world.
Right.
There are some protocols where they're revaccinating patients every 3 weeks.
Mhm.
It becomes expensive and impractical for patients that are from out of town. But by the beginning of the year, we're going to be able to prepare about 10 vaccines instead of one when the patient comes. So at a very reasonable cost, we will have the capability of treating a patient, let's say, for a whole year, every month, if they're able and willing to come every month for a vaccine, because you cannot take this vaccine with you. It has to be kept in liquid oxygen, nitrogen, I'm sorry, liquid nitrogen at minus 180 degrees. And so this is not portable at all. So that's something that it's going to improve our results tremendously. I think that's one of the new things that are very, very promising that we are going to have available for the patients in a very short time.
I'm glad you touched base on the fact of returning back to the facility. I always try to remind patients whenever I'm doing consults with them that going to a facility isn't just like a silver bullet, you go once you're done. You need to work very closely with your doctors. This is where I've seen the most success of the patients that I've worked with. Yes, it's expensive, that cost factor comes into play a lot, but if you're going to invest in alternative treatment facilities, this is where I personally, from my few years of doing this, nothing towards how long you've been doing this, but I see a track record, and those that have been committed to following back with you guys have had better results with their overall care and going sooner rather than later.
Yes.
I always tell people I'm starting to get a lot of newer diagnosed people, and I say before you consider standard of care, because you're already questioning it, at least consult with the alternative practitioners to where they can give you both sides, because I've sent people your direction that have actually consulted with you that you've told, hey, you have a great standard of care recommendations, go ahead and do that for your type of cancer and then come see us. So I think these consultations that you hold with people hold so much value, and the fact that they are free, they can send in those medical records and they can have an in-depth call with you or your team to overview their specific case. So yeah, I want to thank you for mentioning that, because a lot of people do think just going to a facility is just like a one-time thing. So
Correct. And that's an unreasonable expectation, right? I mean, if a patient already has had the experience that they have to have chemotherapy every 3 weeks, every 4 weeks, for at least 6 months, and then to expect that a natural therapy is going to cure them with one application, it is not reasonable.
right. Yes, I agree. I just wanted to invite Gaston on as well, because he was going to mention to you guys about, hi Gaston, about the $3,000 grant that Oasis of Hope is offering to Heal Navigator referrals to Oasis. So Gaston, if you want to just cover the basis, I'll hand it over to you.
Yes, we're very happy to announce that we are providing a $3,000 grant from our Cancer Contreras Fund to all patients that have a relationship with Heal Navigator. The Cancer Contreras Fund is a great fund for all of our patients, and it's a charity 501c. So patients from all over the world, they send funds there to bless other patients. So it's a great way for us to give discounts, grants, and at the end of the day, we're a ministry. We want to help patients any way we can. We know that them coming to Oasis or any other alternative cancer treatment center is a great method of treating cancer. But like Peyton said, the $3,000 grant is for a benefit to all patients coming through Heal Navigator. So if you are interested in having a consultation with Dr. Contreras or one of our admissions doctors, please go through Peyton or go on our website and let us know that you heard through us through Heal Navigator, and it will be applied to any treatment that's recommended by our doctors. As Dr. Contreras said, all patients have a personalized treatment plan, meaning that we review all medical records with Dr. Contreras and the team, and they provide a personalized treatment plan. Many treatments might be the same, but everybody gets an individual plan. And it's always modified when patients get here. It's always modified because we can't learn everything from a medical record. And once a patient gets here, we do the intake form, we do the lab work, the PET CTs, things might change. So that's where the personalization comes in. So thank you very much. And hopefully that's a blessing to all your patients.
Thank you so much for providing that. Just for patients to see that the clinic is willing to give back, it's always a concern whenever I'm having these calls. They're like, oh, they're in it just for the money. Not you guys, just in general. They're in it just for the money. They're so expensive. But then I have to remind them that this isn't covered by insurance. If the regular cancer treatments weren't covered by insurance, it would be astronomically expensive to the patients. Even so, with deductibles and things, patients are paying a lot of money for certain, targeted therapies, as you mentioned, or, certain treatments that they're needing. So I love the fact that you guys are willing to give back, to the patients. As you said, you're serving as a ministry. So it's such a blessing. Again, if you guys are wanting, your questions that all of you guys have submitted, I'm so sorry we're running out of time, but we haven't gotten to them. You can always email us at info@healnavigator.com, and we'll walk you through the next steps of how you can have that one-on-one consult with one of the doctors at Oasis of Hope for that free either Zoom call or one-on-one phone call for you guys. Again, we will be contacting those 5 selected people that will be getting the signed copy of Dr. Contreras's book. We'll make it personalized and accounted to you guys. So thank you for offering that as well. I appreciate you guys so much for always being so willing to connect. And I look forward to hosting more of these here in the near future. So
thank you very much.
Love it.
Thank you, Peyton. So much.
Of course. So I'm going to go ahead and say bye to you all. I hope you guys have a great rest of your week. Before we leave, I will drop my personal link here in chat. If you guys have any questions or you want to talk to me about any facilities, you guys are always willing to reach out to me. I'm here to help any way possible. This is a sole passion of mine, is to be able to connect and go to different facilities across the world, meet the doctors and the teams there, and share with you guys just the nuggets of information I've collected along the way. But I hope you guys have a blessed day, and we'll talk here soon. And thank you, Dr. Contreras, so much for joining in and sharing all your information that you have. I see so many thank yous here in chat. They're so thankful to be able to have an actual doctor come on and just share your knowledge with them. So they find that very valuable.
Thank you very much. God bless.
God bless you.
I hope you have a blessed day.